Living with hereditary angioedema, or HAE, means facing unpredictable and often debilitating attacks. But what if there was a way to significantly reduce or even eliminate these episodes? Let's explore Andembry, a new treatment designed to help prevent HAE attacks. Andembry, pronounced Andembry, is a prescription medicine. Its generic name is garadacimab-gxii. It comes as a liquid solution in a single-dose pre-filled auto-injector or a single-dose pre-filled syringe. Andembry is specifically used to prevent attacks of hereditary angioedema. It is approved for use in adults and children who are 12 years of age and older. It is administered as an injection under the skin once a month. HAE attacks are caused by an overproduction of a substance called bradykinin. This happens because of a problem in a specific pathway in the body. Andembry works by targeting the very beginning of this pathway. It inhibits activated factor 12, also known as FXIIA. FXIIA is the first factor in the contact activation pathway. By blocking FXIIA, Andembry prevents the steps that lead to excessive bradykinin generation. This helps prevent the inflammatory cascade that causes HAE attacks. Andembry belongs to a class of drugs called activated factor 12, FXIIA, inhibitors. It is also a type of medicine known as a monoclonal antibody. Like all medications, Andembry can cause side effects. It's important to be aware of these and discuss them with your healthcare provider. The most common side effects are generally mild to moderate. Common side effects include reactions at the injection site. These can be redness, itchiness, or bruising where the injection was given. Some people may experience stomach or abdominal pain. Another common side effect is symptoms similar to a cold. This can include a runny or stuffy nose, sneezing, or watery eyes. This is medically referred to as nasopharyngitis. It is not known if Andembry is safe and effective in children under 12 years of age. Always tell your healthcare provider about any side effect that bothers you or does not go away. This list is not exhaustive, so ask your doctor or pharmacist for more information. You can also report side effects directly to the FDA. Before starting Andembry, it's crucial to have a conversation with your healthcare provider. Tell them about all of your medical conditions. This includes any past or present health issues. If you are pregnant or planning to become pregnant, discuss this with your doctor. It is not known if Andembry can harm your unborn baby. Your doctor can help you weigh the potential risks and benefits. If you are breastfeeding or plan to breastfeed, inform your healthcare provider. It is not known if Andembry passes into breast milk. Talk to your doctor about the best way to feed your baby while using Andembry. Andembry is given as an injection under your skin, which is called subcutaneous injection. It is administered once a month. You can be taught to give yourself the injection, or a caregiver can administer it for you. The injection can be given into the thigh or the belly area. If injecting into the belly, stay at least 1 inch, 2 centimeters, away from the belly button. If a caregiver is giving the injection, the upper arm can also be used. It is important to rotate your injection sites each month. Do not inject into the same spot repeatedly. Avoid injecting into skin that is damaged, such as moles, scars, or bruises. Also, do not inject into areas that are tender, red, hard, or injured. Your healthcare provider will show you or your caregiver how to prepare and inject Andembry. This training is essential before you attempt to inject it for the first time. Do not try to inject Andembry unless you have received proper training. Children using Andembry should always do so under the supervision of an adult. Before using either the pre-filled syringe or the auto-injector, there are a few preparation steps. First, remove the carton box containing the syringe or auto-injector from the refrigerator. Place it on a clean, flat surface. Do not remove the syringe or auto-injector from the carton by holding the needle cap or plunger. Avoid moving or pulling on the plunger at this stage. Allow the medicine to sit at room temperature for at least 30 minutes. Injecting cold medicine can cause discomfort. Do not try to warm the medicine faster. Never microwave the syringe, run hot water over it, or leave it in direct sunlight. Always check the expiration date printed on the label. Do not use Andembry if the expiration date has passed. Before injecting, visually inspect the syringe or auto-injector. Ensure the liquid looks clear and colorless to slightly yellow and contains no particles. Do not use it if it looks cloudy, discolored, or has particles. The Andembry pre-filled syringe has a needle safety device. It works differently than some other injection devices. Read the detailed instructions for use that come with the package insert carefully before using it. Review the instructions each time you get a new syringe, as there may be new information. Remember, this information does not replace talking to your healthcare provider. Make sure you have been trained by your healthcare provider before using this pre-filled syringe for the first time. To inject, gently pinch the clean skin around the injection site. Hold this pinched area firmly throughout the injection. Insert the needle fully into the skin at an angle between 45 and 90 degrees. Do not change the angle while injecting. Do not hold or push on the plunger while you are inserting the needle. Once the needle is fully inserted, hold the syringe steady. Inject all of the medicine by firmly pushing the plunger all the way down. Push the plunger down until it stops to ensure you get the full dose. Continue to push firmly on the plunger until the very end of the injection. After the plunger is fully pushed down and the dose is injected, slowly remove your thumb from the plunger. Do this before removing the syringe from the skin. Removing your thumb first allows the needle to retract safely inside the syringe. This is a crucial step. Caution: do not remove the syringe from the skin before removing your thumb. Doing so could result in a needle stick injury. After use, dispose of the used syringe immediately in an FDA-approved sharps disposal container. The Andembry auto-injector contains one dose and is for one-time use only. Never try to reuse the same auto-injector. Inspect the auto-injector before use. Do not use it if it has been dropped, looks damaged, has cracks, or is leaking medicine. If damaged, dispose of the entire auto-injector in an FDA-cleared sharps bin. To use the auto-injector, first remove the clear cap. Pull it straight off, do not twist it. Dispose of the clear cap in a sharps container. Do not touch the gray needle shield or try to replace the cap. Immediately after removing the cap, pinch the clean skin at the injection site. Place the auto-injector at a 90-degree angle against the pinched skin. Press down firmly to start the injection. You will hear a first click. Keep pressing down firmly. You will see the yellow plunger move through the viewing window. You will hear a second click when the injection is nearly complete. Continue pressing down firmly for 5 more seconds after the second click. This ensures the full dose is delivered. After holding for 5 seconds, remove the auto-injector straight up at a 90-degree angle from the skin. The gray shield will automatically lock over the needle. Dispose of the entire used auto-injector immediately in an FDA-cleared sharps container. Do not reuse it. The recommended dose of Andembry for preventing HAE attacks in patients 12 years and older involves an initial loading dose. The initial loading dose is 400 milligrams. This is given as 2 separate 200 milligrams injections administered subcutaneously. After the initial loading dose, the maintenance dose is 200 milligrams. This is given as a single subcutaneous injection once a month. Follow your healthcare provider's instructions precisely regarding your dosing schedule. Proper storage of Andembry is essential to maintain its effectiveness. Store Andembry pre-filled syringes and auto-injectors in a refrigerator. The temperature should be between 36°F to 46°F, 2°C to 8°C. Keep Andembry in its original carton box until you are ready to use it. This protects the medicine from light. Do not shake Andembry. Shaking can damage the medicine.